Today, we're fortunate to have Lynn Zellen and Barry Stills. They're with the Kincaid and Stills attorneys and as presenters today. So they're about as expert as you can get on this topic, and I'm sure you're curious. So with that, let's welcome them, Lynn and Barry.
Good morning. My name is Barry Stills, and as Diane kindly introduced me, I'm a partner with the firm of Kincaid and Stills in Lexington. And if you're at the convention in early November, we put this presentation on a couple of times, but we're here today to talk about some more updates and dealing with COVID-19 and the human resources and the OSHA vaccine mandate. And I'd like to introduce my partner, Lynn Zellen, who will be primarily making the presentation today. I'll be off camera to assist in any way I can, but she is about as knowledgeable about COVID-19 and these OSHA mandates as anybody around. So I'd like to welcome Lynn. Thank you.
Good morning. If anybody attended our breakout session at the convention, there were a lot of I don't knows. I'm still reading the reg. It was 492 pages, but we've had a few weeks since then to digest it a little bit, really study what the regs require and provide and allow. And then also, some of you may be wondering, well, why are we here? Because hasn't this been stayed? It's not even being enforced right now, right? So as of right now, there were lawsuits filed in every single federal circuit court in the country. And the Fifth Circuit was the first to act, and it put a stay into place. It said, this can't be enforced right now. And where that stands right now is when that happens, there's a lottery to see which circuit is going to decide this issue. And the Sixth Circuit, which is the circuit we're in, won the lottery and has set a briefing schedule on that stay. Whether that stay remains in place will be fully briefed by December 10th. And I suspect the Sixth Circuit is going to rule pretty quickly after that. Now, what could happen is the Sixth Circuit could say, we're going to keep the stay in place. It could say we're lifting the stay effective immediately, which means on December 10th, or the day that the Sixth Circuit issues its order, everyone has to comply. Or it could say we're going to lift the stay effective 2 weeks from now or a week from now, and then you've got a week or two to comply with all these mandates. So the bottom line is the wise thing to do is to prepare now, at least get your policy written, have a plan in place for if and when this new rule goes live. And so that's why we're here today and moving forward with this training session, even though the regulation or the rule has currently been stayed. I'm going to go over the requirements of the rule. I'll offer several opportunities to ask questions at kind of logical points in the presentation, but if there's something that pops into your mind, like Diane said, please feel free to put it in the chat box and I'll try to address those when I'm able. So the first question is, who does this rule apply to? And it applies to any employer that has at least 100 employees. And I know KACo sent out or published an article explaining that that's really going to apply to most counties, just because, the sheriff has X number of employees and the jail has X number of employees and the road department has Y number of employees. Those are all going to be lumped together for purposes of calculating this 100 employees. So most counties are going to be covered. And what happens if I have 102 right now, but I fire 4 people and I'm at 98? You're still going to be covered. If you have at least 100 employees at any time this standard is in effect, then you're covered as long as it remains in effect. And the reason that they've done that is they think their rationale for this 100 employee threshold is that larger employers have the capacity to develop these policies and put them into place. And so as long as you had the capacity at one point to do that, you're going to remain able to do so. It also includes part-time and remote employees for purposes of calculating the 100 employee threshold. Now, there are some exceptions, some employees who wouldn't be required to comply, but that doesn't accept them from calculating the number of employees that you have for purposes of being covered. So the rule also gives employers 2 options for how to comply. Number one is the straightforward mandatory vaccination for all employees. And that's OSHA's preference, and we'll get into the reasons why here in just a minute. But there's a second option, which is to give employees a choice to either get fully vaccinated or undergo regular, in most cases, weekly COVID-19 testing and wear a face mask when they're at work. You could do a hybrid. You could say this category of employees have to have vaccines. This category has the option. That just kind of depends on your circumstances and if there are certain categories of employees that it makes more sense to just flat out require vaccinations or not. I'm going to skip over the enforcement timeline because that's probably not going to be correct anymore. Okay, so the rule has certain categories of information that employers are required to provide to their employees. The first is the requirements of the standard. Now, actually, I'm gonna go out of order. The workplace policies and procedures. You're required to have this workplace policy and procedure by sometime after the stay goes into effect. This will be required. The rest of these things, the requirements of the rule, the key things to know about COVID-19 vaccines, OSHA's protections against retaliation and discrimination, and criminal penalties for supplying false information, you can print all of those things off of OSHA's website. You don't have to reinvent the wheel here. You can borrow from OSHA there.
Sorry, ma'am. Excuse me.
Yes.
I wanted to make sure I was clear on your statement there about this. This goes during the stay or after the stay is lifted?
All of these requirements will go into effect after the stay is lifted, or when the stay is lifted. And it could be immediately when the stay is lifted, or it could be some period of time after the stay is lifted. Okay, so most of these things, like I said, you can print off of OSHA's website, post them in your break room, and you'll be taken care of there. They're all called, I think, OSHA fact sheet on XYZ. And then the policy and procedure is going to be the policy that you develop.
Lynn,
Yes.
we have a question about the 100 employees. Does that include elected officials? I assume it does.
We talked about that at the OSHA convention, and I think that, well, it depends on the employee. I think it depends on the elected official. Some offices are going to be deemed state employees. Some will be deemed county employees.
Okay.
And then there was I see a question about, does regular really mean weekly, or will we have the option to make it monthly, for example? No, you don't have an option to make it less frequently. If it's an employee that comes into work at least weekly, they have to get tested at least weekly. If you have an employee, though, who only comes in once a month or once every 3 weeks, then they just have to be tested within 7 days before they come to work. So that's going to vary if you have an employee who's not regularly in the workplace.
Okay.
So one of the first requirement for employers is to support employee vaccinations. That's two requirements. Number one is paid time off to get vaccinated, which is up to 4 hours. If they need less time, if they can go next door to Walgreens and get vaccinated and it takes them 20 minutes, then they only get compensated for those 20 minutes. If they need 6 hours because they've got to drive to the next county over for whatever reason to get vaccinated, then you need to give them those 6 hours of time, but you only pay them for 4. If they get the vaccine on a Saturday and they're a Monday through Friday employee, they don't have to be compensated for that time. You also have to provide paid sick leave for employees who have side effects from the vaccine. It doesn't provide a specific amount of time that you have to provide. It just says reasonable time. But OSHA has assumed that 2 days is reasonable for someone to recover from the side effects of the vaccine. Now, if somebody doesn't have side effects from the vaccine, they don't get this extra benefit. You can also require them, if an employee has 2 days of sick leave or paid time off accrued, you can require them to use that. But if they don't have any sick time, you have to grant additional time off, paid time off to recover.
Lynn, there are
Yes.
a few more questions in the chat box that you might want to address now. One is that who pays for the weekly test if there's a cost?
Okay, so this is something that it's a little gray. The OSHA has said employers are not responsible for paying for the tests, but state law, and this is something that I will get to, it recognizes that OSHA recognizes that there are other laws that may require employers to pay for those tests. And under Kentucky law, there is a statute that says that employers cannot require employees to pay for medical examinations that are required for work, which this is probably one of them. There may be a fight over what that statute really means. Is this required as a condition of employment? Is it a medical examination? Probably yes. So as a practical matter, even though this the ETS doesn't require employers to pay for it, as a practical matter, employers probably will have to pay for it.
Okay.
And then the other law that comes into effect there is if you have an employee who's part-time and the cost of the test would bring their regular hourly wage under minimum wage, you can't do that either. So even if that statute didn't apply, you would have to pay for that employee's test. And then also, if you have an employee who's gotten a religious or a medical or disability accommodation and they're getting a test for that reason, you have to pay for that. So as a practical matter, I think, yes, probably employers in Kentucky are going to be required to pay for the test.
Okay, and can a county's EMS test employees?
If they have tests and they're qualified to administer tests, sure. The only restriction really on tests, you can do antigen tests, you can do PCR tests, you can use at-home tests, but they cannot be both self-administered and self-read. So it would have to be observed by the employer or by a telehealth administrator. So I think EMS would be fine. That would be an acceptable method of testing.
Okay, and this is related. Has OSHA posted any specs for the testing method?
Yes, they're what I just said. You can have PCR, antigen, or at home as long as it's not both self-administered and self-read.
Okay, and then what is the status for employees who've had COVID and have an antibody test showing a positive number?
I believe that if an employee has had COVID within the last, I think it's 100 days, then they're exempt from the weekly testing requirement. But an antibody test does not exempt you from this.
Okay, and is a COVID positive test status the same as having had the shot, the vaccine?
No.
Okay.
If you, like I said, if you have been diagnosed with COVID, I think it's in the last 100 days. I've got it in a later slide. I believe it's 100 days because of the risk of false positives. You might continue to test positive. You would be exempt from the weekly testing requirement during that time period, but you would still be subject to the masking requirement if you're not fully vaccinated.
Okay. Some of these things you may be planning to address in your presentation.
Sure. I'm kind of glancing through there.
Okay. Okay.
Do we take people at their word if they have side effects? Yes. I wouldn't recommend like going to their house and making sure they're really tired or have a headache. Is there time off for getting a booster shot? No. Booster shots, once you've gotten your 2 shots of Pfizer or Moderna, or your 1 shot of Johnson & Johnson, and you've waited the obligatory 2 weeks and you're now fully vaccinated, you're done. You don't have to get a booster. Boosters are not encompassed by the rule.
Okay.
How does HIPAA apply? Really, this is an ADA issue, not a HIPAA issue, because we're not healthcare providers disseminating protected healthcare information. But the ADA does require vaccination status and test status to be maintained confidentially. So your policy, or at least you would need to have some sort of policy or procedure for keeping employees' vaccination status and test status or test results confidential, and that needs to be kept separate from their employee files. Let's see. Question about
employees and whether they
county clerks.
Yeah.
I don't know. I would question about county clerks, that the county doesn't pay county clerk employees and they report their own taxes, but they are included on health insurance and retirement reports. I think county clerks are going to be included as employees. It's circuit court clerks that I think probably are not, but Rich may be able to advise you all better on that. A question about over 100 employees, but no greater than 50 in a single location. Doesn't matter what their location is. If you have 50 employees on your payroll or 100 employees on your payroll, that counts. Let's see, another question. 75 employees. The clerk's office has 75 employees. Will it be combined with other offices? Yes.
And that can,
Which shot is FDA approved? I believe that's not an issue with, I mean, I think they all have emergency approval. I believe Pfizer is fully approved, but I'm not sure. But any of the 3 shots that have been given emergency approval would be sufficient under the rule to deem an employee fully vaccinated. Okay. I think that covers all the questions that are currently in the box.
yeah, I think you've answered them all.
Okay. So, okay. Next thing you have to, I mean, I've already kind of talked about this. You have to collect, and this is going to be one of the first things that goes into effect after, if and when the stay is lifted, is collecting employees' vaccination information. You have to ask employees you have to find out whether each employee is fully vaccinated, partially vaccinated, or not vaccinated, for various reasons. And if they're vaccinated, you have to get acceptable proof of their vaccination status. Like I already said, those have to be kept confidential. If an employee says, yes, I'm fully vaccinated, but they don't give you acceptable proof, you have to treat them as though they're not fully vaccinated. The rule sets out acceptable forms of proof of vaccination. The most obvious one is a copy of their COVID-19 vaccine card. You've probably heard stories about fake ones. As long as you're making a good faith effort to look at these, it's not something that, it says that the person or the entity that administered my vaccine was Disneyland. Yeah, that's probably not legitimate, or the provider, the manufacturer was Sony. Sony's not making vaccines. Don't accept that card. So look for some red flags. But if they don't have their vaccine card, they can get an immunization record. They can get either from the healthcare provider, pharmacy, public health information system, or a real catch-all, other official documentation. Barring any of those, they can also sign an attestation saying they're fully vaccinated and then they've lost their card, stating the required information to the best of their recollection, the type of vaccine they received, the dates they were administered, and the name of the provider, all the things that you would expect to see on another form of proof. And then a declaration that that statement is true and that they accept that lying on that attestation could subject them to criminal penalties. For the most part, I think what you're going to be seeing are vaccine, the little 3x5 or whatever cards that we're used to seeing now. Okay, and then another thing that will go into effect pretty soon, if not immediately, if and when the stay is lifted, is that you have to have a policy requiring either the mandatory vaccination policy or the test and mask policy. So this is going to require, this is across the board. Anybody has, every employee has to be vaccinated unless vaccination is medically contraindicated. They're going to go into anaphylactic shock if they get vaccinated. Or a medical necessity requires a delay. They've got some condition that's, they've had COVID, for example, recently, and so they're not eligible for a vaccine right now. Or people who are entitled to a reasonable accommodation because of a disability, or a sincerely held religious belief, practice, or observance that conflicts with the vaccination requirement. And I'll get into those, that process later. So as I said earlier, OSHA very strongly prefers a mandatory vaccine policy. They in the 492 pages, they explain why. And it really boils down to vaccines reduce the risk of severe illness or death. It's probably going to remove the number of employees who have to be removed from the workplace due to testing positive, which is a requirement of the standard. If an employee tests positive, they have to be removed from the workplace and can't return until certain requirements are met. And there's less administrative burden, because if you've got a bunch of employees who are testing weekly, you've got to have a pretty robust system in place to keep track of those. How are they reporting them? How are you keeping them? How are you making sure they're confidential? How are you making sure that you can provide the required documentation within the time required? There may also be, although OSHA has found that as of November 5th, I believe, there's plenty of tests available that may prove more difficult. I've heard anecdotally from some health departments that vaccines are much more readily available than tests. We have a greater supply of vaccines than tests. So that's something to consider when you're deciding which policy you're going to opt for. And then also the cost may be a consideration, since even though the rule doesn't require employers to pay for it, as a practical matter, you probably will have to.
Lynn,
Yes.
before you move on, Judge Johnston wants to know if the fiscal court implements a policy, are the clerk's office and the sheriff, the other offices required, do they have to comply? And then after that, after you answer that question, I think there are a couple for Rich.
Sorry. I think the county as an employer as a whole is responsible for implementing this policy and ensuring that all employees comply.
Okay, and Rich, do you know, Judge Harper wants to know if KACo is working on a model policy?
Yeah, so in that email we sent out 2 weeks ago, this coming Friday, which is also on our website, there is a link to the OSHA model policies. It's the second column, and we can resend that out again. In addition, Lynn put together a really good policy that I'd be happy to share, also as a model. And they're basically paint by number policies, though they are a little lengthy. So we can reshare that if needed. Yeah, we can reshare that if needed. And everything should have been sent out to everybody that's on our Friday email list. Diane should have got that email 2 weeks ago. But again, we can resend that out, or they can go to the KACo website and pull it off there.
Thank you, Rich. And yes, we will resend that. And also, I want everybody to know that today's presentation will be sent to you. We always do that. That will be sent out before the end of the week. So you'll have this as well. Thank you, Rich.
Yes,
And
thanks,
what-
Rich. Okay, so the other option, if you choose not to impose a mandatory vaccine or a vaccine mandate on all employees, is to give employees the choice. Somebody's, okay. Is to give employees a choice between being fully vaccinated or being tested regularly and wearing a face covering when they're at work. Certain employees would be exempt from those requirements. That would be fully vaccinated employees, and then employees who have a low risk of exposure due to their work environment. That's covered in a later slide as well, but it's basically people who work exclusively outdoors, people who work from home, and people who don't report to a workplace where there are coworkers or customers present. This is also going to apply to new hires who have to be fully vaccinated before they start work or provide proof of a negative test within 7 days before they start work. So I'm going to go into the testing and the face covering requirements, focusing a little more probably on the testing. We already talked about the testing requirement. If they come into work at least once every 7 days, they have to get tested at least once every 7 days, and they have to provide documentation of their negative test result within 7 days of their last test. So this is once weekly. You might want to set a date like that each certain departments get tested on Monday or Tuesday or Wednesday. So you're spreading things out, and it's easier to keep track of, and you don't have different employees in different departments going on different days. So there are ways you can try to kind of streamline and reduce the administrative burdens of a testing requirement. If they report to work less frequently, they just have to be tested within 7 days before they report to work. If an employee does not provide proof of a test as required, they have to be excluded from the workplace until they do. So if they're supposed to be tested on Monday, you were tested last Monday, you missed your test this Monday, you can't come to work today. Maybe you have a policy where this employee can work from home, but they can't come into the workplace. Here's the exception. It was 90 days. So if an employee has tested positive for COVID-19, they are exempt from the testing requirement for 90 days after their positive test or diagnosis. They still have to abide by the face covering exemption though, and you'll need to keep track. You've got a spreadsheet that's keeping track of everybody's test results on each date, each week. And then once you get to that 90 days, that employee's got to get back into the testing routine. What if an employee has a doctor statement saying they should not wear a mask? That would be, we're going to talk about disability accommodations. If they have a disability that warrants an accommodation, an exemption from the mask requirement, then you'll have to consider whether that can be accommodated and how. Can you alter their work environment? Can you stagger their shifts? Can you let them work from home? How can we ensure the safety of the workplace in compliance with the OSHA rules while accommodating this person's disability? There are, oh, sorry, I missed a slide. But so the test results, there are, you can't just take the employee's word for it. I can't call in and say, hey, I was negative. The test result has to contain the employee's identification, the date on which the specimen was collected, the type of test they got, who issued the result, and the test result. So that's a lot more information to keep track of. If it's whether you're keeping a spreadsheet or you're keeping a copy of the test result, just all things to consider when you're implementing and creating your policy. I've talked about the different kinds of tests that are acceptable. It could be third party, PCR, antigen. It could be at home as long as it's, or a home test as long as it's observed by the employer or an authorized telehealth provider. OSHA has said that it pretty much expects most employers to use the rapid tests at point of care locations. So either at a testing clinic or Walgreens or CVS or Kroger, wherever they're being offered, because those are faster and they're cheaper. But like I said, consider what days you're going to have them. How are you going to report or collect and maintain the results? There's a question. So if you get COVID, they're exempt from testing for 90 days. That's correct. Thus, the employer has to pay paid time off for 90 days. No, that employer would still, if you have this either or policy, fully vaccinated or test and mask, that employee can still come. They would just have to be masked when they're in the workplace during that 90-day period. And then another that ties into another point that that comes up later. The OSHA rule does not require employers to pay employees for time off if they test positive. So if somebody tests positive and they're required to be out of the workplace for 10 days, you don't have to pay for that time unless there is another policy that would entitle them to paid time off for that time period. Okay, we've talked about this, the cost of testing that other laws probably require, even though the rule doesn't, other laws probably require employers in Kentucky to pay for the test. And that if testing is done during the workday, under the Fair Labor Standards Act, employers have to pay for the time spent taking the test. So that's another just administrative burden or cost that you should consider if you're considering the testing optional policy. Any other questions about the testing process? We've done a fairly good job of dealing with them as they've come up, but
Yes, you have, but when there is one, Kevin Mooney asked if they have to be masked for 90 days after a positive COVID test.
so any employee, if you're choosing the testing and masking optional policy, option number 2, any employee who's not fully vaccinated has to wear a mask at all times when they're in the workplace.
Okay.
So it's not just 90 days after they tested positive. It's as long as this standard remains into effect, they're wearing a mask. But it's that they don't have to get tested every week during that 90-day period. They still have to wear the mask. They have to wear a mask even after. Let's see. Did I skip one?
No, but we
No.
have an additional one. If EMS does the testing, can those be run through the county's insurance?
I'd have to look at the policy. I mean,
Oh,
what in the past, medically necessary tests have been free, but it's not clear, these are not medically necessary tests. These are routine screening tests. So they're not going to be free. And I guess if there is an insurance policy that would cover it, then I don't see any reason why they couldn't be. And there's probably no reason why they couldn't be if CVS runs the test. If it's covered by insurance, insurance applies to the extent that it applies.
And I think you answered this already, but you said employees can use a home test, but they must be in the presence of someone. How did you?
Yeah, it cannot be, what the rule says is that it cannot be both self-administered and self-read. So I can't sit at home before I come into work and do my nasal swab and read my result. That doesn't count. I would need to either do it with somebody, a telehealth provider watching me do it and reading the result for me, or I need to come into work and do it in front of the HR person and let them read the result when it comes back. So
Okay.
that you can't self-administer and self-read the test.
Yes.
So face coverings, this is pretty self-explanatory. The rule, it spells out what types of face coverings are acceptable, when you can use gaiters, how many layers it has to be. It's a really lengthy, but I think, we're all pretty accustomed to what types of face coverings we can use. Has to fully cover the nose and the mouth. And face coverings are required when you're indoors and when you're occupying a vehicle with another person for work purposes. They're not required if you're alone in a room with floor to ceiling walls and your door is closed, or while you're eating or drinking, or for identification purposes, or if you're wearing a respirator or a medical face mask, or if it's not feasible or it poses a greater hazard than the risks it is intended to protect against. So that might come into play in a factory or something where you've got equipment or, something could grab onto it. Okay, so I promised we'd talk about exceptions. Obviously, fully vaccinated is 2 weeks after you got your last dose, whether it was the single dose or double dose. You don't have to get a booster, but you have to provide acceptable proof of vaccination. If you're fully vaccinated and you don't provide proof, you're going to have to test and use a face covering. And there's also the exemptions for people who have low risk because they don't report to a workplace where others are present because they work from home or they work exclusively outdoors. There's a question, did I say that you can have mixed rules for different groups, i.e. mandatory vaccinations for all firefighters versus employee option for clerks? Yes, you can do that. That's a legitimate job-based distinction. You couldn't say, for example, all women have to be vaccinated and all men don't, but if there are work-related reasons for making a distinction, that is perfectly acceptable. And another one, can we use ARPA money to pay non-compliance fines? I do not know the answer to that. I doubt it, but I'm happy to look at that and see if I can give an answer. Oh, sorry. I'm getting ahead of myself. Okay, so I've mentioned this. Employees who test positive have to be removed from the workplace. So you want your policy to have a procedure in place. Who are they going to notify? You've probably already got this in place over the last year and a half. How they notify somebody, how you contact trace. What do you do if somebody's exhibiting symptoms? If you're doing screening when they come into the workplace and they have a temperature, how are you dealing with that? So that's also required under this rule. And like I said, this rule does not require you to pay employees for time off if they test positive, but you might have another policy that does require you to do so. So the rule also sets possible, I think you can choose between these. What do you want to be the requirements to let them return from work? The CDC says if an employee is asymptomatic, they can return 10 days after the positive test. If they have symptoms, they can return after at least 10 days have passed after the symptoms started, and they've gone at least 24 hours with no fever without fever-reducing medication, and their other symptoms are improving, with the exception of loss of smell or taste, which can linger longer than that. So we don't consider that. You could also allow them to return once a licensed healthcare provider recommends that they be allowed to return, or once they get a negative result on an NAAT, that's the PCR test following a positive antigen or rapid test, if the employee chooses to seek it. So I test positive on a PCR test and I say, those have false positives. I'm going to go I test positive on an antigen test, the rapid test, and I go get a PCR test to follow up and it's negative. I could return to work if that's the option that you choose. Any questions about anything that we've talked about so far, because I'm kind of switching gears a little bit from the testing and masking. Okay. Oh, here we go. If someone's waiting on COVID test results, should they be prohibited from coming to work? So they have to produce that negative test result within 7 days after their last one. So if you're using PCR tests and for whatever reason your testing provider is slower than they were last time you got tested on, you turned in your test result on a Tuesday, and now you got tested on the same day of the week, the following week, but the result takes an extra day, then yes, they have to be excluded from the workplace until they produce that result. So the next question is, so the employer has to give the option to either get vaccinated or weekly test and masks. No, there are two options. You can either require everyone to get vaccinated or give that option. So there are two choices. But yes, if you choose not to do mandatory vaccines, then your employees have two options: get fully vaccinated or test and mask. The ETS also has, and that's the emergency temporary standard, reporting requirements for reporting fatalities and hospitalizations. It's really hard to say whether a positive, or to say definitively that someone's diagnosis with COVID or death because of COVID was due to a work-related exposure. And OSHA has kind of set out some considerations. You know, if there was a cluster without any alternative explanation, then it's likely work-related, or else just kind of look at the employee's job duties and work environment and try to determine whether it's more likely than not that their diagnosis was because of a work-related exposure. I mentioned briefly also the records retention and production requirements. So they mean it when they say you have to keep test results, you have to keep proof of vaccination, you have to be able to produce your policy. So go ahead and write that policy and tell OSHA the total number of your employees and the total number of your employees who are vaccinated within 4 hours after they ask for it. So they come in at 10 o'clock in the morning on Tuesday and they say, we want all this stuff. You have until 2 o'clock to give it to them. All the other records, the proofs of vaccination and the proof of test results have to be produced by the end of the next business day. An employee can also ask for certain information that has to be provided by the end of the next business day. That would be that individual employee's vaccine and testing documentation. And then again, the total number of employees and total number of vaccinated employees. You're not revealing any protected health information there because you're not giving names of who's vaccinated and who's not. And I didn't mention earlier penalties, and I'm sorry I didn't have this on the slides. The penalty for a violation is $13,653 per violation. And then that fine up to $13,653. OSHA, as always, is going to consider a variety of factors when deciding how much to actually fine you, considering the gravity of your offense, the size of the employer's good faith, and the employer's history of compliance. But then each day that an employer fails to abate the violation, that fine gets assessed again every day until you fix it. If OSHA finds that there have been willful or repeated violations, multiply that by 10, so up to $136,532. So, you know, some of these things, it's pretty low hanging fruit. Have a policy in place, collect vaccination data. You know, those are things that probably are going to have a pretty quick turnaround if this stay gets lifted. So you want to be prepared to do that if and when that happens. Okay, so I've mentioned that accommodations for disability, and I can't remember if I've mentioned religious beliefs yet. I think I did. But your policy also has to have exceptions or provide for accommodations for individuals who cannot get the vaccine be due to a disability or a sincerely held religious belief. So you want to, if you don't already have a policy in your county for making requests for religious and disability accommodations, you want to make sure either you adopt one, put one into place in this policy anyway, or refresh everybody's recollections as to how this process works. Because I can tell you from private employers who've put these kinds of policies into place, you're probably going to see more requests for religious and disability related accommodations if and when you adopt one of these policies than you've seen in the last 10 years. Let's see. What if everyone declares religious belief? Can they just say it's against their religion? So I'm going to talk more about how to assess these requests. So I'll get to that in just a second. Okay, so disability, sometimes these are obvious. Sometimes you need to ask some questions or request some documentation to determine whether somebody has a disability, which is defined as a mental or physical impairment that substantially limits a major life activity or a history of a substantially limiting impairment. So you might need to ask some questions. You might need to ask for a note from their doctor to verify whether an employee has a disability. So kind of as a practical matter, if you determine that an employee does have a disability that contraindicates a vaccine, then you have to determine whether a reasonable accommodation that would not pose an undue hardship on the employer could mitigate the risk to the employee and to others in the workplace if they don't get a vaccine. And most likely what we're looking at, the most obvious accommodation for an employee who has a disability and therefore cannot get the vaccine would be the testing and masking requirement. I also mentioned in there that somewhere that a family member's high-risk status does not require an accommodation under the ADA. So, okay, religion. We'll just had a question on that. Okay, so do we just have to take their word for it? Pretty much. This doesn't have to be a recognized religion. I can be a member of a religion of one. And as long as it's sincerely held, then it qualifies as a religion or a religious belief under the ADA or under Title VII that requires an accommodation. Now, if you have an objective reason to believe that I'm lying, you can ask some questions. You can ask me to explain it better. You can ask for a written statement from a religious leader. You can ask for written materials that explain my religious belief. Some of these things can be purchased on the internet for a nice donation. But you can ask some questions. If I've acted inconsistently before, if I came to you yesterday and I said, I think this is fake science and I don't want to get a vaccine. And then tomorrow I come in and I say, oh wait, no, it's against my religion. Then that might raise some eyebrows and you might ask me some questions about my religious beliefs and try to evaluate whether they're sincere. But you tread with caution here. I mean, don't just I wouldn't say take everybody's word for it, but proceed with caution. Because it's a pretty broad category to say that it's a religious belief, practice, or observance. But it doesn't protect social, political, or economic views or personal preferences. So in my example, day one, I give you a political or a personal preference reason, and next day I have a religious belief. That's going to give you a reason to ask some questions. Let's see, there's a question. Even if you don't have a mandatory vaccination policy, you still must keep record of religious or health-related disability exemptions. Yes. So regardless of which option you choose, mandatory vaccines or test and mask option, you're going to have the possibility that somebody needs an accommodation. And in either instance, you're going to want to keep. Okay, can you bring that question up again? I'm sorry. I think I got a little. Keep record of religious and health-related disability exemptions. There's not really a record keeping requirement for accommodations, but most likely there's going to be some kind of written record of their request. There's probably, you might have a portal or you might have a written request form for a religious accommodation, or you've got a doctor's note for to indicate that somebody's got a disability, and I would keep track of that. And then probably on your spreadsheet, that would probably be a category on your spreadsheet of fully vaccinated, partially vaccinated, not vaccinated because of a disability, not vaccinated because of religious belief, not vaccinated because they just had COVID and they're going to get vaccinated once they're eligible. They're there will probably be some record of that, but there's no real specified way for how you have to keep that.
And Lynn, there's a follow-up question.
Okay.
So they're asking, should they go ahead and start collecting data, within their offices, on vaccines?
It's not a bad idea.
Yeah.
That was something we were talking about, in November. Like, go ahead and start asking for this, because the ADA does not, a lot of people are cautious about asking employees for health information, but the ADA allows you, and the EEOC has said you can ask somebody if they're vaccinated, and you can ask for proof. But if your employee says, no, I'm not vaccinated, you shouldn't ask any follow-up questions, because that risks getting into health information, disability information that you're not allowed to ask about under the ADA. But yes, you can go ahead and require proof. You can require people to tell you whether they're vaccinated and to go ahead and provide proof. And that is a requirement that's going to go into effect if the stay is lifted pretty early on. The only thing that's delayed is the testing requirement. So the testing requirement goes into effect a month after all the other requirements of the rule. So everything else is going to be all in one fell swoop. It's going to be time to go. Okay, so possible accommodations, obviously testing and facial covering, or full-time telework if an employee is not able to be vaccinated. If an employee also has a reason, whether it's religious or medical, that they cannot comply with the face covering or the testing requirements, then again, consider telework, changing their work environment, staggering their shifts, just any other way to try to protect them and protect their coworkers from COVID. The undue hardship analysis, it's a little different for disabilities. It's a higher bar. It's a significant difficulty or other expense on the employer. If somebody's got a request for religious accommodation, it just has to be more than a minimal cost to the employer to constitute an undue hardship such that you would not have to accommodate their request. And what happens if you can't accommodate an employee's disability or religious belief? They can be suspended. They could be laid off. And I know these are really harsh results, but hopefully testing and masking is going to work for most people. And I think that's kind of OSHA's position as well. There are not a lot of people who, there may be some, but the majority of people could be tested and wear a face covering.
Lynn, Judge Lewis wants to know he wants to know if it would be prudent for fiscal courts with fewer than 100 employees to introduce a clause in the administrative code that all new employees must be vaccinated. I mean, could that be a requirement?
It's not a requirement if you have less than 100 employees. You can, and there have been some private employers who have done this, and probably some governments as well, but I'm not going to require my current employees to be vaccinated, but I'm going to have a mandatory vaccination policy for new hires. And you can do that. You would have to give them there would have to be a possibility for a religious or disability accommodation, but you can do that. Would it be prudent? I mean, if you're at 99 and you're planning on hiring, you've got 6 vacancies that you need to fill, so you're pretty sure you're going to end up at 105. It might be prudent to go ahead and do all of these things to get it into place so that you're not scrambling when you all of a sudden hire 3 new employees and now you're covered by the rule. So it's certainly an option and probably not a bad idea. So the rest of my slides talk about basically just ADA, Americans with Disabilities, like it says here, refresher training, requirements, things that you can and can't do under the ADA. So before I go ahead with that, because this is all kind of old news that we've been dealing with for the last year and a half, were there any other questions about the emergency standard?
Hey, Lynn, one of your questions earlier was from Darlene Plummer, PVA. Because the PVA is not a county office, she might want to check with revenue to see how they're recommending that her office and other PVA offices handle.
Okay. And I think it's the same with circuit court clerks, right?
It is.
So if your office is not a county office, but it's a state office, that office might be excluded from the 100 count, but check with the state, because you might be included as having over 100 employees from the state level. If the county has less than 100 employees, is there anything else we need to do? If, just like I said, if you anticipate that you're going to hit that 100 threshold at some point during the time period that this rule stays in effect, then probably go ahead and plan accordingly. If you don't think it will, then you're not covered by this. I do think there is a possibility that OSHA will expand to include smaller employers. But as of right now, this rule would not apply to a county that has fewer than 100 employees. Does the county attorney fall under county or state rules? I believe that's county. So the county attorney employees would be included in the 100. Do you still have to keep a record of the exemptions, even if you don't mandate vaccines? You would have to have a record. You still have to have a record of every employee's vaccination status. And so if you've got an employee who is not, so you, not necessarily, I guess it depends on whether an employee requests an exemption. So if you give them the option and I just say, hey, I'm not going to get vaccinated, I'll get tested every week and I'll wear a face covering, we're good. You know, I go in that category and I turn in all my stuff. But if I say, I'm not going to get vaccinated because I have a religious objection and I also have a religious objection to testing, then that's going to trigger a different analysis and probably some different records. But the records that you're required to keep are vaccination status and, if applicable, testing status. Let's see. So we have Gail Cowan said, our county attorney is considered state because of child support, except the attorney, and we pay for one secretary. So there, yeah, you look at who's on whose payroll. Where does your check come from to try to figure out who the employee is accountable to. Okay, I got 5 minutes left. I'll hit a couple of highlights because this is something that has come up. One thing while you can send an employee home who has COVID or symptoms or refuses to comply with the procedures, you can't send somebody home because they're in a high-risk category. And one other thing not to do is don't ask if a family member has COVID or has symptoms. You can ask, have you been in close contact with somebody who has symptoms or who has COVID, but you can't specifically ask about a family member. There's a federal law that protects genetic information, and that would run afoul of that. Let's see. So yeah, some of this is all encompassed in the rule anyway. So yeah, you can require employees to wear PPE, you can require them to wash their hands, you can encourage them to telework, and now I guess really you could require somebody to telework if that is a reasonable accommodation. One other note about reasonable accommodations is often an employee has a preferred accommodation, and you're not required to provide the preferred accommodation. You're only required to provide a reasonable accommodation. So if there is no reason that an employee cannot get tested and wear a face covering due to their disability or their religious belief, but they're saying, well, I don't want to do that either, I want to telework, you don't have to let them do that. If the testing and face covering option is viable, then you can require that. And if they choose not to accept that and they want to insist on teleworking, then that's basically deemed that they've turned down the accommodation. That comes up fairly regularly.
And Lynn, you have questions in the chat box. one question about how do volunteer rescue squads and volunteer firefighters figure in, or do they, if they aren't on the payroll?
I think if they're not employees, they're not included in that 100 calculation.
Okay.
If there's a question, if we're not subject to or won't be subject to these orders, can we still ask for vaccine info now? Yes, absolutely. You're allowed to ask employees if they're vaccinated. You're allowed to ask for proof. Just don't ask why not.
And then there's a question specific to county clerks. Did you see that one?
Yes, that they're identified separately.
He just wants
And
to know.
I don't know the answer to that question. I'm sorry. I don't know if you, I mean, plenty of elected officials hire and fire their own employees. But I think if the county is identified as the payor on the employees' paychecks, then they're going to be included as county employees, regardless of who hires and fires. And then there was another question or another point I want to make about if you're asking people for their vaccine status and you're not subject to this requirement, knowing who it is and isn't, and what office policies we may want to implement. One thing to kind of just watch out for is stigmatizing employees who are not vaccinated. Obviously there are going to be different requirements under this rule that fully vaccinated employees aren't going to be required to wear face masks. Employees who are not will be required to wear face masks. So there's going to be some level of obviousness. One thing to be careful of is make sure that if employees have accommodations, whether because of a disability or especially because of a disability or because of religion, that shouldn't be made public. Don't tell anybody that, hey, Lynn isn't vaccinated because she has a disability. That's protected health information that you wouldn't want to share. That's something that you're going to maintain separately and confidentially, and just people will know that they're not vaccinated probably because they're wearing a mask, but they won't know why.
And
Yes.
Jeff, do you have a question for Rich?
Yeah, well, my question then cut off, and I'm sorry about that, but the question is just more of I know this is kind of unknown territory for a lot of counties and employees. As far as overarching guidance, is there anything that has been similar to this as far as a rollout for county government to proxy? And it kind of goes into the whole HIPAA and all the different moving parts of the HR, because some of our counties are so small, we don't have that capacity. So, it's a little bit unnerving, and I appreciate the training today, but I'd feel free for Rich or the young lady speaking to elaborate on that at all.
I don't think there's anything, and Lynn, correct me if I'm wrong, I don't think there's anything like this that has come down in my 20 plus years, because we've not had a pandemic before.
Yeah, there's nothing I can think of. And even, with these challenges to the OSHA reg, there's not really anything that's comparable to this type of a mandate. So as we have been for the last 18 months, we're really in uncharted territory, and everybody's learning as they go. I think at the end of the day, we need to make a good faith effort to comply with these rules and show that you've done so to protect yourself from fines. If it goes, assuming this goes into effect. But we've been dealing with unprecedented circumstances and requirements for 18 months. And this is yet another one, and it's a big scale and it's a big undertaking. A lot of logistical questions to be answered, but that's why we want to prepare now. Try to work out some of those kinks before enforcement begins. There was a last question of how do we run our jails if 50% of the employees quit? That's been a question for private employers, for public employers, that employees are unwilling to come to work due to the risks of COVID, or unwilling to work because of the risks, or because they don't want to get vaccinated. And maybe if that's the concern, perhaps I think what OSHA is assuming is going to happen is that this will incentivize employees to get vaccinated. If that doesn't happen, maybe, or if you don't think that's going to happen in your case, then maybe you need to have the optional policy. But that comes with a little bit more administrative burdens than the mandatory vaccination policy. So there are a lot of questions out there, and I know Rich is happy to answer questions, as am I, as we all kind of work through all this together and figure out how to handle it and move forward. Any last questions?
Apparently not, but there's lots of kudos to you, Lynn.
Thank you. So you've got our contact information here, and they said, understand we'll be sharing the presentation and the PowerPoint. So as you're looking through it and you see something, have some questions, feel free to reach out. We'll do our best to help.
Well, if there are no more questions, Lynn, again, thank you. This has been really great. And although Barry didn't join you at the podium, I'm sure he helped you out in putting all this together. So,
Yes. Well, thank you for having us.
Well, we appreciate it.